Hi, I'm Kayla, and welcome to Kayla Tailored Wellness. I am a family nurse practitioner that specializes in integrative medicine. So what that means is that not only do I care for patients traditionally in the healthcare clinic, but I also prevent disease, encourage lifestyle changes, and treat with vitamins, supplements, and herbs. Today, I want to share my experience getting the Contoura LASIK eye surgery. This is not a sponsored video, I just want to genuinely share my experience. But before we get started, smash that like button and hit the subscribe button for the YouTube algorithm. So I've been wearing glasses since I was 11 years old. I remember first putting on a pair of glasses and no longer seeing a giant green blob as a tree. Like, I actually saw the detail of the leaves. And I wore glasses for a few years until I became more insecure and decided to wear contacts around age 13. I am currently a 3.25 in my left eye and a 2.5 in my right eye. And I knew I always wanted LASIK surgery, but I'd always heard that you should wait until your late 20s when your eyes are no longer growing or developing. And so I think the main point is just to wait until your eyes are more stable and your prescription isn't continuously changing. The biggest reason I chose to do LASIK is because I no longer want to take my contacts in and out every day and night. And I also have a fear of losing my contacts, especially when my eyes are dry from traveling or sleeping on a plane or even snowboarding. And so I think I'm ready for LASIK. I wasn't necessarily planning on doing LASIK this year. I was actually at my yearly contact eye exam, and my optometrist referred me to Dr. Parikh at NVISION Eye Centers in La Jolla. So I did a consult there, and my care coordinator explained the procedure. She did an additional vision exam and specifically measured my cornea. So normal corneas are about 540 to 550 microns thick. Mine was actually 570 microns thick, so that means I have really good thick corneas. And they want a thick cornea because during the procedure, they're going to have to actually cut a flap open in the cornea and lift it up. And so if you don't have thick corneas, you're more likely to have complications. The optometrist there reviewed my chart and recommended that I do Contoura, which is a type of LASIK that is a newer technology and is more accurate. I chose my surgery date, which was about a month out. I specifically chose a weekend that I could wear glasses the week before and then not have to wear makeup the week after. And I wanted a Friday just because I could rest and recover over the weekend. I chose Contoura because it is the most state-of-the-art technology for LASIK right now. How I understand it is that Contoura measures your eye using topography. So it measures every peak and valley of your cornea to get the most accurate measurements of the shape of the cornea. And so just like your fingerprint, every cornea is individualized, and Contoura measures 2,200 different points of the eye, where LASIK only measures 2,000 points. So although Contoura was slightly more expensive, I want the best technology treating my vision. So about a week prior to my surgery, I did have a dilation exam by my optometrist. And so in order to get the most accurate measurements, I couldn't wear contacts for at least 3 days prior. So contacts affect the shape of the cornea, and so by wearing glasses, the cornea can go back to its natural shape, and then we can get the most accurate measurements for surgery. So I'm going to continue to wear glasses up until my surgery day, so that when they do measure my cornea, it is its natural shape and I get the most accurate results. So a month prior to my surgery, I start fish oil supplements to help prevent dry eyes. And then a week prior to my surgery, I do preservative lubricating eye drops every few hours to again help prevent the dry eyes. And then about 3 days prior to my surgery, I start some antibiotic drops. Because I'm in healthcare, I do an extra antibiotic drop just to help prevent MRSA from getting infected in my eyes. So on the day of the procedure, I worked the morning shift and then I came home and just made sure I showered, only because I like to rub my eyes in the shower, and you're not supposed to rub your eyes anytime after the surgery. And I also wanted to shower because I wanted to just be clean for the surgery, and because you're not supposed to shower for 24 hours after the surgery. So I wore really comfortable clothes on the day of surgery just because I knew I wanted to come home and sleep. So I practically wore pajamas. And then I made sure that I had audiobooks, podcasts, water, snacks, like everything set up at the bedside so I'd be ready to rest. So when I got to the surgery center, I paid for my surgery. It was a little over $5,000. Contoura is more expensive, but I do want the best technology for my eyes. They also rechecked the data on my eyes and just made sure there was no changes in my vision. So Contoura requires a special test right before the surgery where you look into this cone and it's black and white striped, and you blink, blink, open, and they take a photo, blink, blink, open, and they take a photo. And they do that about 10 times on each eye, but my left eye was so dry that they couldn't get good images. So I had to put eye drops in my eye, wait a few minutes, keep them closed, couldn't look at my phone, and then they retook the images, which came out normal for the surgery. Then after that, I went into the surgery waiting room. There was nice lounge chairs, there was snacks, water, and I took 2 Advil and a 1 milligram of Xanax about 20 minutes before the procedure. So just a trigger warning, this is actual footage of my surgery, and as a healthcare provider, I was a little oozy watching it. So if you do want to skip ahead, these are the seconds that you can skip to. And just want to shout out to Dr. Parikh and NVISION for allowing me to share my experience with you guys.
Before your LASIK procedure, we got your mask, you got your glasses, you got your name tag, you got your Xanax and your Valium. We're set to go.
Good to go. Yep.
We're about to go into this procedure room.
Kayla, we're ready for you. Come with us. You can leave all your belongings right there for right now. We'll move it over.
We always do. Well, hold on. We don't need your glasses. So we can get
Glasses off, no zone, yeah.
Never again, right?
Never again. We're definitely not one of them. Come on this way right here. Alright, I'm going to take a look at your eyes, make sure everything looks good. So I'm going to blink a few times, and then you can share. How are you doing today?
Good.
Just one quick last eye exam before the procedure. Make sure everything looks good.
Alright, you look awesome. So we're going to bring under the laser, you're going to see a green flash just here to the center of the beam. We'll do the right left eye, show real smooth. We looked over all the data, everything looks good. When you're done, the vision's going to be a little foggy, a little blurry, you just go home and rest.
Okay.
And you have an
Dr.
appointment.
Parikh is explaining the procedure, and he is confirming that I have a follow-up appointment tomorrow morning. It has to be within 24 hours of the surgery.
There's a green flashing light, just focus on that, okay?
They then had me lay down and stare at a green light. Here he is placing numbing drops in my eyes. He placed a patch over my left eye since they're going to be doing surgery on the right eye first.
Alright, so Kayla, just keep your eyes closed. You're doing great now, so get everything set up, okay? We have Kayla Taylor.
Okay. Want something under your knees here?
Sure.
Awesome. Go ahead and lift your knees. See, it's a lot easier for your back. Alright.
Right, Contoura minus 291, minus 15, at 57. Left eye minus 369 minus 407.
Here they are just preparing the surgical table, getting ready for surgery.
Are you doing okay? Just going to try to lift your left with your chin up a little. I'm going to have you blink a few times. You see a lot of lights there. Those eyelashes back. Look out for me. Look at the green light.
He clamped my eye open, and since your eyes are numb, you don't have the sensation of
Drops
needing to
going
blink.
in. Anything burning or stinging or not too bad? These are tears going in just to keep the eyes lubricated, okay? You're doing perfect. Turn your head left, lift your chin up a little. Just a little like that.
Right eye is minus 85 plus 183. Again, minus 85 plus 183.
So slightly inferior. Kayla, you want to look at the green light. You're doing perfect. We're bringing the camera lens in.
The machine they are placing over my eyes is what creates the flap in the cornea.
That's perfect.
It felt like a bit of pressure, almost as if it was pulling on my eye and holding it in place.
Center on your visual axis.
As they did this, I stared at the green dot and it slowly became more pixelated, and then I couldn't see anything. I could also smell a sensation of burnt hair, and I could hear a loud noise. They counted down for 30 seconds with the machine over my face, and then once it was released, I could see again.
15, 10, 5.
Back to the side.
We're just going to go over to the other side. We'll get the left eye done while this right eye recovers a little bit.
He then released the clamp and closed my right eye so that he could do the same thing to my left eye.
Nice and flat. Settle in. Go over to the left eye, work on that one, come back to the right one. Turn your head to the right, lift the chin up a little. There you go. Spin the mask slightly. And then go ahead and open your eyes, blink a couple times. And then look down for me. Look up for me. Look at the green light. Some drops are going in. Same here and there. You'll feel a slight stretch, a little uncomfortable, right? We're going to put some drops in there. Anything burning or stinging? Not bad, right? You'll feel a little touch.
Right eye is minus 85 plus 183. Again, minus
Left
80.
eye. Turn your head to the right, lift your chin a little bit.
Left eye plus 158 plus 201. Again, plus 158 plus 201.
Okay, so we'll go nasal and inferior. I'm going to have you look through this camera lens like last time. Do you see a red light there? Just look right at the red light. Look slightly to your right. Okay, just plenty more there. And look 1 degree left. Good. 1 more degree left. You go back in. Did the light go away? It's going to be a little hard to see now.
Check back.
Perfect.
Concentration fading.
Yeah, go 1 more left. Yeah, that was great. Light's gone, you're looking good. We'll let that 27 seconds. So now we're just centering on your visual axis. You're looking good. We need about 20 more seconds like this. 15. 10. 5.
Complete. Back to the south.
Perfect. We're going to go back to the right eye. Beautiful. Alright, we have the LASIK flaps created on both eyes. You're looking good. We're going to go back and work on doing the treatment, okay? You're doing fine. Just blink a few times. How are you doing? Okay? Those are the hard steps. You got through them all. This is the part where we actually make the vision a little better. Pretty bizarre, right?
It's weird. Yeah.
Turn your head this way, lift your chin up. You're going to start seeing some lights coming again. And you're going to look for the green light once we get your eyes straightened up. Okay? I'm going to have you look
He
down.
then returned to my right eye to open up the flap and do the Contoura laser. The Contoura laser lasted less than 10 seconds.
You see some lights?
Yeah.
Do you see a green flashing light?
Yeah.
Okay, that green light's your target, okay? You're gonna feel a little touch here, tickle your little loose eyelash here, get rid of that. Nice. Just keep looking at that green light, you're doing awesome. Keep looking just like you are. We're going to adjust your head position, lift your chin slightly, good. I want you to just try to find that green light, okay?
Okay, let's do right eye for Contoura. -290, -15 at 57. Target is plain out. Estimated treatment time is 8 seconds.
Still see that green light? Yeah, a little foggy, a little blurry, that's normal. You just want to look right into the center of that.
Center again. Center. Ready.
Keep finding that green light just like you're doing. Get some drops in here. Guess what? You're all done with the right eye. So do you normally wear glasses or contacts?
I didn't usually wear contacts. It's been pretty hard wearing glasses recently.
Yeah, you get used to that for a second. And what kind of work do you do? Where at?
Here the surgeon had opened the flap, did the laser on my cornea, and then closed the flap. And here he is just making sure the flap is flat, and then he will switch over to my left eye.
Some are busier than others. Right?
Yeah. It really depends. At this point, I could see the instruments touching my eye, but I was trying to look past them at the green light. I didn't have any discomfort because, again, my eye was numb.
Your right eye went really well, looks beautiful. We're just taking out the eyelid holder. I'm going to turn our attention over to the left eye again. Close your eyes. Keep them closed.
How old is Contoura?
We've been there for at least 3 years now. It's been out actually longer, but the software got really good in the last couple of years. That's why we feature it. Take it.
About 3.5. Seriously, the last 2 years.
Do you see the green light or not really?
No, it's kind of blurring through.
Yeah, so we're going to try to make it clear in just a second. You just kind of look wherever you see it. Just look at it. Stand out. kind of moving the light is bouncing around a little bit. You still see the green?
We have Kayla's left eye for Contoura, minus 369, minus -07 at 39. Target is Plano. Estimated treatment time is 9 seconds.
Focusing on the center. You're going to hear the sound of the laser. Vision's going to be a little foggy, a little blurry today. I'll give her a feel of that.
Should I stay off screens?
Yeah, but you know computer work for at least today and tomorrow. Probably definitely today. Tomorrow you can get out late and kind of, but just kind of limit your time because sometimes it drives out the back of your arm too long. Who's your driver today?
Her name is Megan. She is here in the hall.
Driving home.
Yes.
Today you just go home and rest and see how you're going to get your time tomorrow, sometime in the morning or something.
Yeah, I'll see you later soon. But yeah.
It's going to be a little fuzzy.
Overall, the procedure was less than 20 minutes. Once I was done, I was able to see, but my vision was slightly hazy. The surgeon then used the slit lamp again to evaluate the flap. He just needed to make sure that there was no wrinkles or abnormalities within the flap. I was able to see and walk to the car afterwards, but I did have a friend drive me home just because I had photosensitivity and just wanted to keep my eyes shut, and I was under the influence of the Xanax.
Wake them around, that spreads. And close your eyes. Don't rub it, just touch it from the edges. Sometimes I need drop.
So I went home with some really cool eye shield goggles, and those are used to protect me from rubbing my eyes and dislodging the flap. When I got home, I slept most of the evening. I did wake up to eat dinner. I was able to see and focus on my food, but I was sensitive to light. I ended up only taking the Xanax that night because even with the Xanax, I was speaking very slowly and at one point woke up gasping for air. And so I realized that I was a little too sedated to take any Valium, but they do offer about 5 milligrams of Valium just to help you sleep throughout the night, which I didn't need. So the next morning I woke up and could see without my glasses. It almost felt like I had slept in my contacts that night because I could see okay, but my eyes did feel very gritty, just very dry. I never experienced any pain or photosensitivity to light. So I went to my optometrist's office the next morning and he tested my vision. I had 20/20 vision. He rechecked the flap and it wasn't dislodged or wrinkled, so that was reassuring. Some people do have to go back to surgery if they mess up that flap. And then for the next week, I didn't wear makeup or exercise, and I tried to actually wear goggles while I showered just because I didn't want the water hitting my eyes. I followed up with my optometrist 1 week after the surgery. He re-examined my eyes and confirmed I still have 20/20 vision. My flap is still in place and looks great. I will see him again at 1 month, 3 months, and 1 year after surgery, and then I will do annual eye exams. I do have a lifetime guarantee, so if I do have any vision changes, then I can return for a free upgrade. Overall, I had a really great experience, and I would recommend Contoura LASIK eye surgery. Well, that's all I have for you guys today. Thanks for embarking on my LASIK eye surgery journey. Comment below. Let me know if you got LASIK and how it went. Did you do Contoura? You can follow me on Instagram at Kayla Tailored Wellness. And in the description below, I do have a link to competitively priced supplements. And thanks again for watching and letting me tailor your wellness.